Welcome to the Animal Training Academy podcast show. I'm your host, Ryan Cartlidge, and I'm passionate about helping you master your animal training skills using the most positive and least intrusive approaches. Here at ATA, we understand that navigating the vast challenges you encounter in training requires a comprehensive base of knowledge and experience. It's common to face obstacles and rough patches on your journey that can leave you feeling overwhelmed and stressed. Therefore, since 2015, we've been on a mission to empower animal training geeks worldwide. We've aided thousands in developing their skills, expanding their knowledge, boosting their confidence, and maximizing their positive impact on all the animal and human learners they work with. We are excited to do the same for you. Simply visit www.atamember.com, join our vibrant community, and geek out with us. And of course, in the meantime, enjoy this free podcast episode as we explore new ways to help you supercharge your training skills, grow your knowledge, and build your confidence, so that you can craft a life that positively impacts every learner you encounter. But we will start today's episode where I'm thrilled to welcome back to the show the wonderful Tabitha Kucera. Tabitha is a registered veterinary technician specialist in behavior, Pryor Academy certified training partner, certified cat behavior consultant, and one of only around 30 veterinary technician specialists in behavior worldwide. Her passion for animals began early, growing up surrounded by a wide variety of companion animals and volunteering with rescue organizations as a teenager. Working in veterinary practice and rescue exposed her to the heartbreaking reality that many animals lose their homes or even their lives because of misunderstood behavior. That experience inspired her to dedicate her career to helping people better understand the animals they share their lives with. Today, Tabitha works with both dogs and cats, helping prevent, manage, and resolve behavior challenges while promoting fear-free, low-stress care. In addition to consulting with clients, she is an internationally respected educator, speaker, and writer who is passionate about improving the welfare of animals through education and compassionate, evidence-based behavior practices. So without further ado, it's my very great pleasure to welcome Tabitha back to the show today.
Thank you so much for having me. I always love seeing you. We need to see each other more.
I know. I was just reflecting, I'm putting together a presentation about podcasting for someone, and it's just made me really realize the reinforcers of podcasts. So the presentation's about what makes a successful podcast, and I realized as I was trying to create content on that, depends how you define successful. Depends what your reinforcers are for doing this, and it really just made me appreciate somehow I've created a life where like this is work.
Connecting with people, catching up with cool people.
The most amazing people.
It's a good gig.
Yeah.
But it's also a really helpful resource for others. I love podcasts. Like I listen to so many when I'm running. Or hiking. It's like my way to kind of decompress.
Yeah, what a cool thing. I feel blessed anyway. Feel blessed to have you back with us. So thanks for taking the time to come and hang out with us again at Animal Training Academy.
Always.
And I said in your bio that you're a compassionate and good at, and also, I don't know the word I'm looking for. You think it is important to, there's a word that just sums it up better, but it's just not coming to my brain at the moment. Educate people, and you're passionate, there's the word, about doing so. So I'm excited to talk about some new offerings that you have created and to share those with our podcast audience today. But just to rewind a little bit first for our podcast audience and to give them a little background about specifically how this episode has come about. We have a post that goes up about every 2 weeks in our Animal Training Academy members only Facebook group. The post is created by one of our wonderful happiness engineers, aka community moderators, Belinda Young. and it's called Toot Your Own Horn, which is, as the title of the post suggests, for our members to do just that. Toot their own horn and share with us, the ATA membership community, the fantastic things they're up to. And Tabitha jumped in on July 21st at 1:57 p.m. New Zealand time, not to be specific, but I looked at the post and that's the time it gave me. And you wrote, I'm celebrating a project that's been on my heart for a long time, finally becoming a reality. So congratulations.
Thank you.
Today, my new mentorship, Better Together, Advocating for Dogs and Cats at the Vet, officially opens for early access. That was on July 21st. This course grew from countless conversations with behaviour consultants, trainers, groomers, and veterinary professionals who shared a common challenge, wanting to collaborate more effectively, but sometimes finding themselves navigating communication gaps, differing perspectives, or feeling like their observations and concerns weren't fully understood. Seeing it come to life feels like a huge milestone, and I'm so excited to welcome the very first cohort. Thanks for creating a space to celebrate the big wins and the little approximations along the way. So firstly, Tabitha, just again, let's toot your horn. That is awesome. Congratulations.
Thank you.
And tell us about what this means to you. You mentioned this mentorship has been on your heart for a long time. What was the specific light bulb moment that made you realize that you had to build this specific program?
So part of my awesome gig is, of course, I get to meet lots of amazing animal welfare, behavior, veterinary professionals, not just through, cat and behavior consulting, Animal Training Academy, but I have the pleasure of speaking a lot at conferences and I offer peer-to-peer mentorship. So I get to meet all these amazing people. And over the years, not only have I had these challenges, to be transparent, because I think many of us have, but I've had so many colleagues, especially in the behavior and training world, kindly tell me, feel comfortable enough to express their concerns, right? Safe space, about how they've had numerous challenges with maybe collaborating with a vet team or communicating to a client that they're noting things that they would love to be further evaluated. Because sometimes, I'm the first person to mention to a caregiver about an abnormal gait or something else. And I always take it as this is actually an awesome thing. I kind of flip it because I'm like, once we identify it, we can help. Like, this is so awesome. But then I also share the common challenges with seeing those things. And because people immediately kind of blame themselves. And I always say, my mom is awesome, but I have a lot of stress. So immediately kind of take that shame and guilt. We all want what's best for our animals. But also as behavior professionals, it can be really challenging because sometimes you may feel not seen or heard or your concerns are dismissed, whether it's from a client or from a vet team. And if you're seeing things that are concerning where we need a collaborative approach, which to be fair is most to all things, not that we aren't all great, but we are one part of the care team. And when you work together, it's corny, but it's true. You have a lot more success because we all want what's best for that animal. So I've learned a lot over the years about problems I've had, maybe things that I did wrong, as far as communicating or narratives I created that were wrong. I think that's a very real thing. We've all done it. But then also things that I've had work and why they worked, along with understanding, because I hear concerns from vet med, behavior professionals who may have negative things to say about each other. But as someone that's in all those worlds, I can understand where some of those concerns are coming from with each party. And the big picture is we all want what's best for the animal, and the narratives and some of the assumptions we are creating and this us versus them mentality is actually really, really harmful. So that's kind of where this came from. Like, how can I support others in handling these challenges? Because they are hard. They are emotionally charged, which makes everything instantly more challenging. We all have ego. It's okay. We have to admit that. And no matter what party you are in, ego does take some part where you're like, how dare they not listen to me when actually they never received your email or they maybe didn't like the customer service, the account at email never got to the vet, right? Like, or on the other hand, like, how is this client not listening to me and how challenging it is, and kind of using words like the client's non-compliant, which is not a word I use anymore. And I haven't for a long time, whether it's concerning vet med or behavior. But again, these narratives that we create, and a lot of it is ego. And also we all have imposter syndrome and things like that, which also definitely affects it too. Cause you're like, do I suck? Why are they not listening to me? These are all things I have felt, but also I know many of us have. And honestly, there aren't a lot of resources about this. And I know communication is kind of like, if you told me 10 years ago, I'd be talking about communication, I would laugh, but you can have the best behavior plan ever. If the caregiver doesn't understand it or doesn't understand the why, it's really challenging. Like, we really need to kind of approach the caregiver as one part of the care team for that animal. Like, I have teams where, my own animals, like just my dog has a rehab vet, two GPs, a neurologist, me and my partner, and we have worked with behavior professionals outside of me in the past. So, and she's not a dog that needs groomed, but if your dog needs groomed, that's another part of the care team, which I know can be overwhelming. But now that I work with these teams as a whole so much, it's actually really empowering and educating and helpful to get us all on the same page. And then that person may see things they couldn't see before because we gave them the opportunity to learn about it, which I think sometimes we just when you say like, how dare they not listen to me? You kind of shut them out, and you might even make that caregiver averse to sharing their concerns, big picture.
How dare they not listen to me?
We've all felt that way. Felt that way.
They're so non-compliant. I'm talking about my dog. I'm not. What are you? No, I joke because we don't really. Being the listeners of this show, people who are interested in how we work with animals, and through leaning on tools like ethical hierarchies or behavior change interventions, we don't think about our non-human learners like that. It's interesting to me to contemplate. And I do this. I'm guilty. I'm not standing here on my podium or my mountaintop or my rooftop or my high horse. I'm coming here as the hypocrite, as the flawed human, which Kathy Sedero reminded me recently is kind of not a redundant term. Like, we're all flawed, obviously, right?
Yeah, for sure.
But I need to remind myself of that. And to borrow from Susan, like, Dad Ryan would get a lot of value from attending some of my training workshops. And he would learn a lot, and he should probably come along. But you said it's corny. What were we talking about when you said it's corny? It's corny to say. I just find it's interesting.
No, you're reading into my language, which is helpful because it's something I'm aware of. So, right, we all have implicit bias. So some bias we're aware of, some we're not. But then we all have different learning histories. And I love communication. I understand the value of it, and I have more and more every year. And a big part of that, thankfully, I'm privileged that I learned a lot about behavior, which has helped me really understand, because again, you can have the best behavior plan ever, but if I cannot communicate it, or you may have such valuable observations, which you most likely do, again, we need the caregiver, we need the trainer, we need everybody. But if you can't communicate those in an effective way, like if you're just sending a sentence of stream consciousness, or you send me 10 pages and practically, I have to care about that vet colleague who, understandably, it's not the greatest thing, the work that they're putting us under, but doesn't have time. Just like if I was talking to another trainer and sharing observations, I wouldn't send them 20 pages. I don't, that kind of stuff. But I think I said the word corny because I think I've been somewhat conditioned to be we're talking about communication, it's super lame. like it's generic and corny, and it's not, because I understand the value of it. But I think my past learning history, we talk about the way communication's talked about sometimes. It's not, it's seen as a skill, but when you see it talked about, like, let's think about LinkedIn, for example. It's a bunch of generic, the way people talk about communication, it's like generic, you Googled this and found these 3 points. And we don't really talk about, as a society, not behavior professionals, as a society, the importance of communication. Like, you're kind of giggled at if you're like, let's take a communication course. And I used to be this, like, 20-year-old me would be like, ha, 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 that's silly. So that's why I think where that word corny came from.
So, we're talking before we pushed record about teaching, some teaching that I'm doing at a zoo, and we're talking about saying yes and rather than yes but. And I'm aware of some of my own behavior that when I present that information, I might say something at the start like, this might sound like HR buzzwords, or
Yeah.
and I not sure why I say that, but I'm aware that I say that. We need to stop saying that because this stuff is important.
Yeah, I'm trying to be more aware of it, because I think
Me
in a
too.
way he values the,
Yeah.
again, I'm working on it because I understand, I see the value. Literally, you can't do anything without communication. Behavior is communication. And we all know this, but, and I know I kind of talked about where some of those ideas came from to why I use that word, but I definitely am trying to, like, for example, say like, this is HR or this is Cordy. We should try to be aware of those things and not say them, but we're flawed as well. So it's a good thing. Because I even say sometimes when I'm lecturing, I'll talk about, I talk a lot about trauma-informed communication and what that is. And yeah, there's the, like, main points, but I also talk about the emotional back end of that and practical applications. Like, we can say, advocate for this animal. Like, for example, that's a word that I think I may have different definitions than other people. It's a buzzword, which we like that people are saying that, but let's define advocacy, because advocating isn't saying something like your animal has pain, like a very broad, vague statement that in behavior, we're with anything else, we would never say that. But like, your animal has pain, go to the vet, which is a great thing to say. But I also recognize that that is so vague and not very helpful. So just like if I was like, your dog's scared, and just left it at that, we wouldn't do that, because we have to consider context and patterns and baselines, and that's the other thing. So I see these behavior professionals I work with who are amazing and get to see these animals in their home and get to talk to these caregivers a lot more than maybe that general practitioner does for 30 minutes once a year. So their observations are so valuable. But then when it comes to sharing that information, are we turning those observations into useful information in a way that that other learner can take that information in where it's actually helpful? Like the way I used to share my observations, whether even with caregivers, but also with vet teams, has changed a lot over the years, because I've recognized, just like we were talking about tag teach before this, 5 words or less. I'm not going to send you 10 paragraphs. I might send you a bullet points of what I'm seeing, and then 3 videos along with a baseline pain score. So I'm giving you data in a digestible way that you can read. So that's the other thing. There's all these amazing observations. Are we sharing our interpretations of those observations, or are we sharing the observations? Like, it's just so interesting the more I've learned over the years, even on how I was sharing my observations, which was very valuable. But now looking back, I'm like, I can understand why that maybe wasn't read. I can understand why that maybe wasn't taken as helpful as I thought it was. So kind of, and then also understanding that it's not personal, even though it feels very personal. It feels so personal. So I have like little pep talks because again, none of us are perfect. And I try to check myself because all of you are aware of your things. Mostly we're all working towards knowing, identifying's the first thing. But sometimes I'll feel something and my feelings are valid, but I'm like, friend, this is not personal. It's what I always tell. And it's funny because I think I started saying it and towards myself because when I'm working with animal welfare professionals or I work with like fosters a lot and the animal may be experiencing some escalated fear when person is 10 feet away or 5 feet away. And I always say to them, because again, humans love animals and they immediately they blame, why does this animal not like me? Why does this, like all of these narratives coming from a really good place? And I'm like, it's not personal. She's in a new environment, right? That's something, because I want to immediately take that away, because I'm not lying, but that human is blaming themselves and creating narratives and not looking at the observations. They're interpreting. And then how are they interpreting that? Like your caregiver may say, my dog's being a stubborn butthead, which that is very helpful information. That's where we work to kind of say, oh, thank you so much for sharing. What behaviors are you observing that make you feel that way? That's a one sentence that isn't shameful. It isn't judgmental. And I use this in GP too. Like they could be like, my cat's being a dick. We hear it all the time, whether I like it or and that's valid information. Like I will just say, oh, what behaviors are you observing to make you feel that way? So they feel seen and heard. I'm actually getting helpful data. I'm not shaming or judging them. And I'm doing it with one sentence. Because realistically, we don't have an hour to take a history. Like that's just, if we're talking about vet med, for example, or even in behavior consulting, I always tell my caregivers, I'm with you for an hour and a half, 2 hours for this initial consult. And I talked to you before this for 20 minutes, right? And I still need to get more data, right? So also I think sometimes in all the fields, we don't give each other the benefit of the doubt. I think that as someone that's in the world, I see it on all the sides, but I see it more commonly. And now I understand where some of those things are coming from. But a big part of it is communication gaps. Like a huge part of it is communication gaps.
So advocacy, part of it is speaking up, but there's egos involved. So another big part of it is about earning trust. How can an animal care professional listen to this show start earning that trust if they have no prior relationship with a client's vet?
So one thing, that's a really great question. One thing I always do is, to be fair, no matter, it's all over my website. It's spread throughout it's kind of the culture I have built within. I understand I'm a one-person practice, but I've built this. It's just part of my culture. So I would highly recommend, which is a process, just building this as part of your normal culture. Like animal care is a collaborative effort. My caregivers are aware of that from the start, where I'm like, to be fair, I personally only currently take referrals through my network. So they're already in my network. I already have the vet records prior to, because again, all of my time is also valuable, which is still cringe to say what we're working on because it is. That's the other thing, right? My time, I can't be reading 30 pages. That's not fair for me either. So I think being straight up front right away and being like, this is a collaborative effort and letting the client be aware of that. To be fair, a lot of my clients don't even have relationships with vets, which is also part of our job as behavior professionals. Unfortunately, there's a lot of negative stuff, which is very upsetting. And with social media, it's getting worse. And many caregivers don't even recognize the value of preventative care, especially for cats, right? Cats are the most popular pet. Yet in America, and we see similar trends in other countries, we're seeing them at the vet less and less. And yes, veterinary deserts and finances contribute to that. But honestly, a bigger part is caregivers are like, my cat's indoors. They never have to go to the vet. Like they don't even have relationships with vets. They don't understand the value of vet care. And then we're like, hey, we're seeing this, but they don't have a relationship. So I think creating a culture where starting from the beginning, you talk about a collaborative approach. You probably are already doing this, but I always ask the client what their care team currently looks like. Because to be fair, some of my clients' animals a groomer isn't needed. But I have like 3 clients right now that I'm actively working with their groomers to create handling plans to decrease stress for everyone involved. And I could have just not asked about the care team. To be honest, I maybe wouldn't even have an idea that groomer was part of that animal's care team. So I think asking them what the care team is, implying like, hey, this is collaborative from the beginning. And then if the client reaches out, I also ask, like, if the vet referred you, of course, you're going to reach out and say thank you and let them know I saw them for a consult then, or I'm seeing them for this day. But if that isn't the case, you're going to advise the caregiver, which is what I always do. Are you okay if I contact your veterinarian? That's a really crucial part, because your veterinarian can't share records without your fee. Because also you don't want to be contacting the vet. Not all my caregivers and vet communications, everyone's CC'd on them. There's no secrets. Because I think that happens sometimes too, where we don't approach it collaboratively. So I think I'm going on and on, but creating a culture where teamwork is implied at the beginning. Sometimes it's implied once something severely concerning is seen, and then it's harder to get that on board because now it's an emergency, right? When my caregivers know before they even schedule with me that I'm going to be working with your whole care team. And I want your care team I also don't want to just contact your groomer out of nowhere. I want you to see if your groomer's comfortable with working with me. And right, that's the other thing. Because sometimes I think we just contact people out of the blue, and I get it. To be fair, I don't feel this way, but I also recognize that someone might be like, who the hell is this person? I don't know who this person is. And they're emailing me and telling me all this stuff. Like, so I think just generally like introducing yourself. And when it comes to introducing yourself, I have the clients ask what their vet's preferred form of contact is. Because for some of my vets, that's phone calls on Tuesdays and Thursdays. For some of my vets or vet techs or groomers, it's via email. And sometimes it's the hospital email, which means in the subject, I'm going to say, attention, Dr. Smith, mutual client, Polly Smith, like whatever. And then that will get forward to that vet versus just sending it to info at and then getting upset when, to be fair, in many cases, the vet didn't even get the information. So that's a really long answer.
Called passion talking here at Animal Training Academy, and we advocate for it.
It's all I know how to do.
That's why we love you here. And I want to get a t-shirt I want to get 2 t-shirts. One that says my dog is a stubborn butthead, and one that says my cat's a dickhead, because they have fantastic sayings. Both true about my one. No, I'm just joking.
No. And to be fair, that is valuable data. Like, that's part of our jobs, whether I'm working like as a vet tech, but also as an animal behavior professional. I understand why the client is communicating like that. Labels do serve a purpose. That's how most people communicate. And that allows me to ask more, because again, I can't get 5 hours, whether I'm in an exam or a consult, I can't ask them 5 hours of questions. So I can ask them a question. They could share like my cat's butt head. I can share that question and then ask more open-ended questions based on their answers. Like, it's even when it comes to us getting history, the way I was taught to do that as a vet tech is not in tech school. It was very generic, vomiting, coughing, sneezing. I'm like, yes, no answer. What? This isn't helpful data, and I'm wasting my time. Versus, yeah, I'll have my go-to questions, which we do as behavior professionals, but then we ask more open-ended, individualized. That's why we love this job. It's very individualized, and we have to adapt in the moment to what that caregiver is telling, and pick those. Like, they might be like, my cat all of a sudden didn't get, like, they used to be best friends and they're not. Like, that's super helpful data, but we're going to unpack that a bit more, kind of thing. Versus being like, I'm going to use this moment to tell you about labels. We're not. Hello. You got to kind of, I talk about how we should be when I lecture. I mean, I talk about that all the time, but when you're talking about it to a caregiver, that's the other thing. You can't, we all know we want to say everything all the time. You can't. That's not, like, if they're using an aversive tool, I'm not going to have them take it off within the first 2 minutes which I understand it's challenging for me to see that, but also that caregiver is probably doing the best with what they know in that moment. And we communicate in a way that they then choose to take it off on their own without me telling them. That's over the years, I've recognized that I've become a lot better of a teacher because the learner comes to the conclusion on their own. There's autonomy there, and that's powerful. We talk about autonomy with animals all the time, but sometimes I think we don't do it with colleagues. I mean, even trainers with trainers. Sure, we've all had experiences where sometimes I remember the one time I was working with somebody and the trainer that they were working with said that this only happened once, but it blew my mind, said that they will not work if their dog is seeing another person, they can't do it. That's not how this works. And I remember being like, holy moly, that is severely concerning. And I didn't shame or judge that trainer, even though I felt ways. I'm being transparent in my brain, but I use that as an opportunity to empower and educate that caregiver to be an advocate. And I already create a culture of it takes a team. So usually caregivers already feel more comfortable with me and they then chose to work with me. But it wasn't like a do this or else. Again, I just educated and empowered them. And our jobs as behavior professionals and vet med is to coach, educate, and support, non-direct support. I'm not here to tell you what to do because what I would do may be different than what you do. There's no gold standard of care is not a thing. That's a vet med conversation, but that doesn't exist because we have to think of all of this context. Like if that dog has severe fear, anxiety, and stress every time they go to the vet and they have to go to the vet 3 times a week for a treatment, we have to talk about like these are the real conversations that, you know, we have to have challenging conversations. So I think that's another reason where all this trauma-informed communication makes a big difference.
I've jumped on your website and looked at your course outline, your mentorship outline, and you talk about advocacy mapping. What is that and how can trainers use this concept in their practice?
So I have this really cool resource and I'm going to look it up because Ryan knows my brain's a little broken because I lost my cat last week. And this is where we're transparent with each other because my brain is, but I have this really great resource that really breaks it down better than I could right off the top of my head. But essentially, I can't find it, but essentially what it is, I don't have an organized computer. Can anyone relate? But essentially what it is it's a thing I do in my head, but I made kind of a resource for it where I take in who's on the caregiver team, like who's the animal's care team, what position do I have in that team, what's my scope within that team, how I can help within that team. And like, for example, I did one with a caregiver who is a foster. So that makes it even more, right? So to be fair, that foster can't necessarily make medical choices. That foster can't say, I want blood work on this dog, really, right? So that changes the way we approach things. And since I kind of lay it out in my head, that advocacy mapping, like it also helps me because it kind of like gives me some comfort in times where I don't have control over everything. And this isn't my fault, if that makes sense. So in a way, it's actually really helpful for us to manage and prevent burnout and compassion fatigue, which are real big parts of all of these gigs. But then it also helps me understand where because I may ask that caregiver to do something. And if I didn't have that advocacy mapping, I can't ask the caregiver to do that. Someone else does, right? And that also lets us know what our limitations are, because that's real. That is a real part of our jobs. We can't do everything. And everything, what I would do may look different. So that advocacy mapping helps me understand who's on their care team, what's everyone's scope of practice, what role do they play in this animal. And it just helps me, like I just do it in my head right now, but that's not something I used to always do. I'll be honest, like me asking the caregiver who's all on your animal's care team that's something I started doing the last few years, right at the beginning. Like I always talked about vet teams, but I didn't ask about, because another thing, I work with quite a few pet sitters, and I work with a few companies. Like Meowtel is a cat pet sitting company that I've worked with a lot. And pet sitting is a career. Again, it's another thing that's devalued. And unfortunately, there are some problematic, I don't want that client to just Google a generic company. We don't know what company I'm talking about. And have a, like, pet sitters are a huge, so I do so much collaboration with pet sitters. And honestly, 7 years ago, I might have not even been asking them. And that pet sitter may have came and not been able to give that animal medications, or that animal has severe stress when the caregiver leaves for a week, which is most of the cats but also some of the dogs. And there were really simple things that we could do to work together to decrease stress for everyone. And every pet sitter, because also you also have to recognize your limitations. Some people are not open to collaboration, and that's hard, but this is the reality of the world. So every pet sitter I've ever worked with has been amazing, and they are just super stoked to learn more about considerate approach. And my experience with pet sitters have been so amazing. But again, that's a part of the care team. I'm not trying to, like, I never really thought about 7 years ago, you know? So that advocacy mapping really helps you kind of get the whole picture and just have more empathy in general. Like, this vet sees this patient for 30 minutes for once a year. They don't have because we don't talk about the value of blood work. This vet has no baseline for blood work values, has no baseline for can you imagine, everybody, how challenging it is to diagnose things? Because diagnosis is about exclusion. And when I talk to clients about the value of blood work, and I explain this, like, hey, they need a baseline because, for example, my one cat's white blood cells, her baseline is that the white blood cells are a bit high. I can understand why a vet would choose different additional diagnostics if they didn't have that context. Like, and also it saves money. So yeah, just, it's interesting because I think even the way we talk about vet care, even the way I talk about blood work and radiographs and other things compared to how I talk about it now, and I was in GP, is different. I'm like, I understand why that client didn't see the value in that dental cleaning. And yeah, I'm talking about myself because I'm not perfect, but and like the way I communicated that was not very helpful. So I've gotten better at communicating that stuff and helping them understand the value. And I understand they may not be able to afford that blood work, but I want them to be aware. For example, like Ryan and I were talking about a client that I have where I'm talking about pain a lot, but we worked together and I worked with their vet team, who's amazing. And we identified some pretty significant medical issues. And we're working on medication training. But we literally just started because I just met these clients. So in the moment, in the immediate, oral medication, real talk, this is a reality, could not be given. And also pain should be approached multimodally in every case possible. So what I literally did was I wrote out all these multimodal therapies. So I talked about, of course, environmental modifications. I immediately recommended. All of you amazing trainers can make animals' lives easier every single day with adapting their home to their needs, which will look different for every animal. But then I shared all the different modalities and a little bit more about them, like laser therapy, which there's very little research, but laser therapy, acupuncture, NSAIDs, opioid. And I don't expect many of us to talk about all these things, but you can let them know that pain needs to be approached multimodally and like let them know about these things. And then they are now empowered to make a decision. My job is not to make a decision for them, but my job is to empower them to make an educated decision on having all the information. And many people don't. And then they're thrown into making decisions based on very minimal data. And we've all been there. That's rough.
I could even just say that making decisions is tough, regardless of how much data you got. Like, it exhausts me on a daily basis.
And then making behavior, when we're dealing with a client, like most of my cases, I mostly only see pretty severe behavior
What? No
cases.
one
So,
rings you up and they're like, Tabitha, my cat is behaving beautifully. Can I do a consult? It doesn't happen to you.
but
But
I have lots of people attend my awesome lectures and look at my content and stuff who just want, which is great. But what was I saying? Oh my gosh, my brain.
in week 3 on your course, I saw you teach trauma-informed communication.
Mm-hmm.
What does that mean in the context of talking to clients and veterinary staff? And am I correct that it can help prevent conflict? Is that like a motivating
Yes. So funny. Well, I
reason for
think
teaching it?
again, I'm talking about communication throughout the whole course, of course, but I kind of define what we've heard, like the go-tos, like the foundation. But then I talk about practical applications. So for example, I'm a huge fan of scripts. And what I mean by that is I'm not here to tell you what to say, but when we're in an emotionally charged situation, having a template is very helpful. And then, of course, adapting it. So whether I'm talking to vet colleagues to talk about if a caregiver comes in saying they want to declaw their cat and they're being really like, their background, they aren't VTSs in behavior. This is really challenging. And even if you are, that client can be really emotionally charged. And although they don't really feel the way they're saying some things that are pretty intense. So I like to create like a few bullet points of like, here's a common thing that we hear that's really hard. And here are 3 sentences that I would say in that situation. And the cool thing is again, I was going to say it sounds corny again, but then I stopped myself, Ryan. Practicing these conversations is really helpful. So for example, something we'll do in the Zoom portion, but also I do at workshops is I'm not about generalizing, but this serves a purpose. We might put a difficult, because there's really no such thing as a difficult client, right? But we might put a specific situation we come across a lot, like that is challenging. We pick it out of a hat and then we role play, and it's really fun and awkward. But then that person gets way more comfortable versus like you would never throw, hey, I'm a caregiver, I'm a green trainer. You throw them in a pretty severe situation. You would never do that as a trainer. Just like when I'm teaching handling, I'm not like, we're going to start with high FAS animals. That would make me a really bad teacher. So when it comes to communication, we don't approach it like that very often. Usually, I mean, in GP, that was my experience. I was thrown into severely challenging, like a client would come in with their dog hit by car. I have to run in the room and say CPR, DNR, and like have really like, whoa. And we were kind of thrown into really challenging situations. So I share common challenging things because that's really, communication, trauma informed, it's so easy. It sounds so easy. But then when you are actually thrown in these situations, these are skills that I had to build up. This wasn't just I read a book and I can do this now. And I still struggle. Obviously, I never email anyone over threshold. Like those foundations that I've learned over the years, like I take pauses. I call friends in some cases because there's been some pretty severe things where people have said really rough that I still get upset about. But so I not only took a break before I responded, but I actually called a friend for advice. So we essentially talk about the foundations of trauma-informed communication, but then really cover applying it in those challenging conversations that we aren't necessarily talking about and we don't really get a lot of practice in. Like, for example, the vet said they were fine is something we've all heard. But as someone that's in both of the worlds, the caregiver heard that's not actually what the vet said, right? How did the caregiver interpret that? But also, right, they see them for 30 minutes in that one moment. And then the caregiver, like my caregivers are advocates, like they understand every vet visit you get, you take 2 to 3 minute videos of your animal doing their favorite thing and walking. Because even the best vet in the world your cat should not walk up and down the hallway at the vet clinic. So, also I have them compile, I want you to have notes in your notes app with all your animal supplements and meds. Because my dog went to the ER recently, no joke, my brain's broken. You're over threshold. all that. I also have all my animals, all their blood work and radiographs and exam findings on my phone because that is information that is going to be so helpful. But then also I have my clients, I'm like, write down your top 3 concerns because a lot of people aren't comfortable, and it's not even anything to do with necessarily that medical professional. With human med, it's the same way. You kind of like, there's been times I've left the doctor and I'm like, girl, you're like the advocate of advocates and your stupid ass didn't, I'm allowed to shame myself. It's okay. Didn't ask that question. Girl, what you doing? And I also tell my caregivers that, like, or caregivers maybe dismiss their own observations. Like me and Ryan were talking earlier, and he has some concerns about one of his animals, and he's like, I have a gut feeling. And I'm like, that gut feeling is important. Like, that matters. You may not be able to define exactly where it's coming from. And that's where we work together and we figure that out. But that gut feeling, like, clients should feel empowered to ask questions and advocate for their animals, but also in professional, kind ways. Because I've seen both. Again, I've seen both ways, and I understand why my colleague might become. I'm not justifying them becoming, defensive immediately, but I also many of us in vet med and in behavior. You may have 4 patients. You're severely over threshold in that moment. Right. There's so much context, which makes it really complicated, which is why the more I can build up on those skills for myself, because you can't prepare for everything. That's not reality. But the more I can build those skills up to fluency to the best I can, like now I want the challenging client, right? How we would define that. Because I do a lot better in those situations than I used to. That doesn't mean it doesn't emotionally take a lot out of me, which is also where I have to advocate for myself and say, I only see severe behavior cases, which I love, but there's a reason why I speak a lot, because I need I love connecting with others and educating and empowering, inspiring, like that gives me life. It's very reinforcing, but also I can't just see severe behavior cases all day. I will not last long in this field if that's all I'm doing. That's just not practical.
There's so much in there that I want to talk about, but I'm going to allow you to share with the listener where they can go to find out about your mentorship program, because the answers to my questions would also be available in there. And this conversation would go on for
we could talk and talk
longer than the car rides that our listeners are in while they listen to this podcast episode. So where can people go specifically? I do want to briefly touch on some other opportunities you have coming up, but where can people go specifically to learn more about? Do you want to get the name right?
So you can
Better
go to
Together Advocating for Dogs and Cats. You didn't allow me to get the name right. Better Together Advocating for... No, that's all right. It's not important. It's just me needing to say it for some weird reason that I don't understand, but I can examine that later. Your mentorship, Better Together Advocating for Dogs and Cats at the Vet. Speak, Tabitha.
I love this. Me and Ryan are so funny. The listeners get it. There's some people, they definitely get it. But you can find it at more information about it and register at small-paws.ca. So it's Small Paws Education, or you can find information about it. I'm actually updating my website right now, which is exciting, my business website. So it's not out just yet with all the new stuff, but I share it on Chirps and Chatter social media, but then also Small Paws Education we have a Facebook and an Instagram and all that lovely stuff.
So is Small Paws Education your platform?
Yes. So me and one of my amazing friends, Shannon, co-founded Small Paws Education earlier this year. It's been in the works for a hot minute. Shannon's amazing and has a huge background in putting on conferences and doing a lot of the beautiful background work of putting courses together and making them beautiful and easily digestible and fun, because there's so many creative ways we can make learning more fun for that individual human learner. And then I love the being out there speaking, marketing, educating. So we're such a good team. But yeah, we started this awesome education platform that I'm really excited about with some other amazing instructors. We're starting small because we're a powerful team of 2, but the plan is to continue to build. But we have a lot of really great courses on there now with some amazing instructors. And then I also have a how to start kitten kindergarten mentorship coming up with the amazing Kristen Vitale soon. And I'm super stoked about that because, again, it's strange. There are very few resources and so many amazing people want to start kitten kindergarten. So we're doing, I love a mentorship where we have the online learning, the awesome practical resources that you can use every day, but also the personal connecting of addressing your individual concerns, asking your questions, being an open, safe space where, we all feel a little more comfortable like this versus I'm going to post this in a Facebook forum, even though Animal Training Academy is a wonderful forum I actually feel safe in, which is a skill to all of you, because that's a whole thing right now in social media.
Yeah, I don't venture outside of my group much on Facebook. And you've also got a mentorship coming up on medication cooperative care. Is that correct?
Oh, it's not out yet, but yes, I have so many. I've been wanting. It's amazing because I get to uplift and highlight so many, like Aaron Jones and Stephen Sittal and all these amazing people that I have learned from, and I want everyone else to learn from. But also, I love speaking. I speak a lot, but I surprisingly have not put on a lot of my own content. And as a business person, we were talking about business. You'd be proud of me, Ryan. I have so much information I want to get out there and have it be accessible, not only to vet med behavior professionals, but also caregivers and pet sitters. And something that I'm passionate about, as you know, is cooperative care. And part of that also includes medicating cats. So I was like, everyone keeps asking, and I love this energy. And there's only so much I could do in a 90-second Instagram reel. So I have a whole course that is not, we don't have the date announced yet, but I'm actively writing cooperative care courses. And then I also plan on hopefully next year, because everyone understands how in-depth the course is, but I have some handling, just overall handling courses, including handling high fear FAS cats and dogs, because that's another thing where a lot of us are put in those situations, especially in animal welfare and vet med. And I would never go into a home without management first, but I remember working in GP and just being kind of thrown into a situation with minimal to no management. And I'm like, oh my goodness. And all these animals' pain and fear and stress exists. So, but the cool thing is, as you know, there are always things we could do to prevent, decrease, or manage fear, anxiety, stress, and pain. So that's what it's going to be all about. I'm excited.
That's huge. I saw the lineup. I saw Aaron on there and can't remember who else, but I was impressed.
Oh, no, everyone is so amazing. And we still have some, again, we're starting small, but Erin has a mentorship. She's actively working on it, so I don't want to announce it for her, but I might take it because it sounds amazing. And I love Erin and I've learned so much. I mean, she's a friend, but also I met her through her work. That is, if you ever read Aaron Jones's books, highly recommend it. She's coming out with a new one that I'm super stoked about. But yeah.
She lives down the road. Well, not really.
Oh, I forget you're both in New Zealand.
Geographically speaking.
Yes.
Still a couple of hours away. But
it's funny. I talked to her through Zoom or when she's at conferences. So I always forget where people are from because we never actually see each other at our houses. It's so funny.
Well, thanks again so much for sharing everything today, Tabitha. Forces for doing this podcast are also just to be able to promote my friends' work. So I always look for opportunities to do that, especially when they've got new platforms or courses or books or projects or this, that, and the other coming out. So my pleasure. And through that, obviously, we can get this information out to our listeners, which can help with their clients, which can help with their cats and their dogs. So all in a day's work. And we'll get all of us linked in the show notes for you, the listener. And we appreciate you all.
Have a wonderful day, you amazing people.
And thank you so much for listening as well. This is your host, Ryan Cartlidge, signing off from this episode of the Animal Training Academy podcast show. We hope today's conversation inspired you and equipped you with new tools for your trainer's toolbox. Remember, every challenge in training is an opportunity to learn and sharpen your animal training geekery. Embrace the rough patches, learn from them, and keep improving. And don't forget, the path to growing your skills and expanding your knowledge continues beyond this episode. Visit www.atamember.com to join our supportive membership, where you will find a community of trainers just like you. Together, we're making a huge positive difference in the lives of animal and human learners worldwide. Until next time, keep honing your skills, stay awesome, and remember, every interaction with an animal or human learner is your opportunity to create ripples. We're here cheering you on every step of the way. See you at the next episode.